Is there anything that can be done about my bone-on-bone knee pain or about my knee arthritis? This is the question that I get asked a lot. So listen, if you're struggling with bone-on-bone knee pain or arthritic changes in your knees, and you're wondering what can be done about this, if anything, and you're worried about maybe going down the route of injections or surgery or a knee replacement, and you're struggling with pain while you're going up the stairs or hiking, walking, getting up from a chair or sitting in a chair for long periods of time, so glad you're here, because we're going to be talking all about arthritic changes, bone on bone, what that means, and what the future kind of holds for opportunity when it comes to a situation like this. Hey there, I'm Dr. Brooke Olson with the Physio Revolution, #1 best-selling author and chronic knee pain specialist. I'm so glad that you're here because we're going to be talking all about arthritic changes and bone on bone and what that really means for people who struggle with knee pain. So, first things first, I want to go over a bit of kind of the stages of knee pain. What we know now through a lot of research is basically that arthritis is normal as we age. So I want to talk about some normalizing aging patterns that happen at different stages of arthritis. And the reason that we know that is because a lot of people who don't have pain and we take an image or an x-ray or an MRI of their knees and we see what's going on in there, there's a lot of changes that happen naturally as we age. And we just call these wrinkles on the inside. So let's go over what kind of the stages of wrinkles are when it comes to your knees, okay? So stage 1 of wrinkling inside your knees, I'm going to zoom in for you because I know that's a long shot, but stage 1 is basically minor changes. The blue is your cartilage. And cartilage is basically just an outer covering of your bone. This would be your femur on the top, femur on the top, tibia on the bottom, so that's your leg bone down here and your thigh bone right there. And the blue is just marking where the cartilage is at the time being in this sort of stage, if you want. Some minor changes, maybe 10% of changes in stage 1. Now, wrinkle stage number 2 is just kind of some narrowing of the joint. Right, we might have a little bit of fissures in the cartilage, and the cartilage might diminish a little bit more, and some more fissures or osteophytes, if you've heard that term. So that's natural as we move into some more wrinkling. Then we get into stage 3 of arthritic changes and bone-on-bone changes, right? And cartilage starts to lessen a little bit more fissures, top and bottom on the knee, and some more narrowing of the joint space. And lastly, stage 4 is some more narrowing, some more fissures, and some more cartilage loss, right? So it just kind of continues to fold like that, where we see cartilage loss, a little bit of narrowing, and some osteophytes or fissures. And that's absolutely normal when we talk about wrinkles on the inside of our knee, because arthritis happens to everybody as you age. It's normal for people even in their 30s to get arthritis. So if you're struggling with kind of looking at an x-ray going, oh my gosh, what's going on? Is it in, do I have to have a knee replacement? Do I have to have injections to help my knee pain? Not always. Not always at all. And the thing is that there is more opportunity. There's a fun thing that I told a client the other day, and I'm sure that you can probably relate to this. The thing is when it comes to your knee pain, so if, let's say the process is like this. Let me grab a marker. In the morning, you're in pain. And a lot of people talk about that. Or you're in stiffness, or you have achiness. So in the morning, let's say you have that, and then like in the afternoon, let's say at probably around 2 o'clock, things get warmed up a bit, and you have minimal to absolutely no pain, right? And then in the night, it just starts to creep back on. So you start to get stiff, you start to get achy, right? And you start to have pain. And in the morning, you repeat the process. Here's the thing. Does your x-ray change throughout the day? Meaning, in the morning, if we took an image of your x-ray, would you have arthritic changes because you have pain? Sure. So at noon, when you have no pain, if we took an image of your knees again, does the arthritis go away? Does the bone on bone go away? And then in the evening, if we took an image again, do you now have arthritis again? Do you get what I'm saying? There's a lot of people who have symptom relief, throughout the day when they have arthritis or they have bone on bone. And the problem is not what's going on in the knee. The problem is that a lot of people focus on fixing this when really they're missing the key aspect of what controls the knee, which is either above or below the knee. And a lot of people just focus in on fixing the knees and trying to get them stronger when really they're missing the key pieces of how do we work above in the body to help control the knee, and how do we work below at the foot and the ankle to control the knee. So if you are struggling with knee pain and you're thinking, wow, this isn't getting better, and I do have some symptom relief, or I don't have pain throughout every day or all times of the day, so it might not be my arthritis, you might be missing a key aspect of what's going to actually help you get knee pain relief. So if you have been struggling with knee pain and you want to know if what we do can help someone like you and in your situation of knee pain, then I invite you to just click on the link down below and schedule a time to talk with one of our team members. It's absolutely free. It's a good place to start to figure out if we'd be a good fit for one another. And just to let you know, we don't take on all people. We only take on people that we know that we can help. So you'll start by talking with one of our team members about all that's been going on, and they'll ask you a few questions. Make sure this is a good fit for you and a good fit for us. And if so, you can ask more about what that journey looks like with us. And from there, then we can talk about the next steps of what that needs to look like for you specifically. So if you're interested in learning more about knee pain and want to tackle this natural process of wrinkles on the inside, and you're struggling with arthritis or bone-on-bone knee pain, I invite you to click on the link down below right now to book your call. And we'll talk to you soon.